Welcome to Mock Interview Pro, where we equip you with the skills to shine in your next job interview. Today, we're focusing on a career as an optometrist, an essential role in eye care. Let's dive right in with our first question, which addresses handling challenging patient situations. Could you share an experience where you had to manage a difficult patient interaction? How did you handle it? This question helps interviewers see your ability to communicate effectively and keep calm under pressure, crucial skills for any optometrist. Here are some key points to consider when crafting your response. Focus on a specific incident that highlights your communication abilities. Clarify what made the patient challenging and what their concerns were. Explain your approach to addressing their needs and calming the situation. Discuss any follow-up actions you took to resolve the issue. Wrap up with the outcome and what you learned from the situation. Now, let's look at a sample answer to give you a better idea.
I once had a patient who was quite upset about a delay in their appointment. I made it a point to listen to their concerns, apologized for the inconvenience, and explained why there was a delay. Ensuring they felt listened to, I offered to reschedule their next visit at a time that suited them. In the end, the patient left satisfied and expressed appreciation for my attentiveness.
By the way, we're only covering a handful of questions in this video, but I've prepared a free PDF with all 30 top interview questions for optometrists. It also includes example answers and tips to help you prepare with confidence. The download link is just below. Tell me about a time you worked closely with an ophthalmologist. How did you develop that working relationship? This question is designed to assess your ability to collaborate and communicate effectively with other healthcare professionals. To answer this question effectively, consider the following. Describe the context of your collaboration with the ophthalmologist. Highlight specific actions you took to build a strong rapport. Discuss how communication was key in your relationship. Mention any challenges faced and how you overcame them. Conclude with the positive outcomes of your collaboration. Here's a well-rounded example to illustrate.
In my previous role at the clinic, I collaborated with Dr. Smith on a series of complex cases. We scheduled weekly meetings to discuss our patients' progress, which helped us align our approaches. This consistent communication fostered trust and respect between us. When faced with a challenging case, I made sure to proactively share my observations, which further strengthened our partnership. Ultimately, we succeeded in improving patient outcomes together.
Can you describe a scenario where you misdiagnosed a condition? What did you learn from that experience? This question evaluates your honesty, ability to learn from mistakes, and commitment to professional growth. When addressing this question, keep these points in mind. Be open and honest about the mistake. Provide context and details about the specific condition. Explain the steps you took after realizing the error. Highlight what you learned and how you've improved your skills. Conclude with how this experience influences your practice today. Let's consider an example and answer to demonstrate.
During my residency, I mistakenly diagnosed a patient with dry eye syndrome instead of allergic conjunctivitis. After reviewing the case, I realized my error was due to neglecting the patient's allergy history. I promptly adjusted the treatment plan and informed the patient of the correct diagnosis. This taught me the importance of thorough patient history and diligent follow-up. Now, I ensure to ask detailed questions about symptoms and possible allergens.
How would you handle a situation where a patient's insurance doesn't cover the procedure you recommend? This question tests your ability to navigate financial conversations with empathy and clarity, ensuring patient satisfaction. Consider these strategies when forming your response. Acknowledge the patient's concerns about cost. Explain the importance and benefits of the procedure. Offer alternative options if they are available. Assure the patient they are supported in their decision. Maintain open communication and encourage questions. Here's an example response for guidance.
I would first recognize the patient's concerns about their insurance coverage and express my understanding. Then, I would explain the procedure's benefits, emphasizing how it would improve their vision. If they remained hesitant, I'd suggest alternative procedures or payment plans, ensuring they know I'm here to support them in whatever decision they make.
What steps would you take if a patient arrives with a sudden eye injury? This question assesses your ability to respond effectively in emergency situations, a crucial skill for any healthcare provider. When preparing your answer, think about the following. Stay calm and assess the situation quickly. Ask the patient for details about the injury and symptoms. Perform a quick visual acuity test if it's safe. Advise against touching or rubbing the eye. Refer the patient to emergency care if the injury is severe. Here's how you might approach this question.
First, I would remain calm and reassure the patient. I would ask them how the injury occurred and what symptoms they are experiencing. If safe, I would check their visual acuity to assess the severity. I would advise them not to touch their eye and then refer them to the appropriate emergency care if necessary.
Before we wrap up, remember you can get all 30 questions, example answers, and step-by-step tips in a handy PDF. Totally free, just grab it below.